clinical psychologist, and I work in psychotherapy, in a psychiatry hospital, and also in private practice. And the main activity is to do the assessment of the patients in these departments. In the part of the assessment, I do, first of all, I'm looking to establish a relationship with the patient. I put some questions and to help him relax and answer. It would be easier for him if he has a connection with me. After that, I do the assessment on the cognitive and, if necessary, on the emotional level. Regarding to caregivers in the hospital, I do not always have access to them, but in the private practice, they are usually come with their caregivers, and yes, I give feedback, and I also look for talk to the caregivers to understand that, let's say, behavior modifications are part of the disease, not because the patient is rude or he doesn't care, the caregiver, and so on. When I do have results, usually in my private practice, I see patients 2 times a month free from because they are allowed from their insurance. The next time I see him, it's a 45-minute session when I discuss mainly on 4 points. The first one is about cognitive training, and I'll tell the person what he can do about this at home. Then I'll talk about, I give examples to many kinds of games, and online or not, with caregivers, on other relatives or colleagues, and so on. And regarding this, I talk about the importance of stay connected with older colleagues, with neighbors, with relatives, and so on. After that, I talk about nutrition, mainly with the caregiver, because they are, depend on the stage of dementia. And after that, I'll talk about the importance of stay active, and how important it's, let's say, about walking. 3-4 times a week, walking about 30 minutes, or 2-3 times a week, but fast walking. And different kind of activities, let's say gardening, or depends of, I'll try to individualize everything on the patients in front of me. It's meaningful for me to do something for these people. Usually things are very happening very fast. Do the evaluation and send the patient home, and see him monthly, give him medicine, and that's all. And no one has time to, medical doctor, they usually have little time. So no one educates patient, and I try to do something for them. For me, it's important to have this connection, because they are often old persons, but they have their life experience. And usually in psychotherapy, it's saying that you never know who teaches who and who learns from who. And there are so many wonderful people. You have so many to learn from them. That's for me. In a hospital, the patient is already there. It's the psychiatrist send the patients for assessment and intervention if it's the case. And to the private practice, usually psychiatrist or neurologist send the patient to me to do the assessment at the beginning. And after that, if it's the case, to do the interventions.